Welcome to Restore the Glory podcast. My name is Jake Kim.
And I'm Bob Schutz.
We're two Catholic therapists sharing what we've learned personally and professionally to help you on the journey of restoration. If you've been blessed by our podcast, please prayerfully consider partnering with us on Patreon. Your support will help cover the cost to produce the podcast, but will also give you access to exclusive content like monthly reflections and special live stream teachings. Go to patreon.com/restoretheglory and join the mission of experiencing the restoration of our God-given glory. Hey, Bob, good to be with you again. It's always good to be back with you. Last episode, we started off a simple series on therapists or therapy, or essentially it's a lot of the questions that we get and we've gotten over the years about therapy and how to, the whole big gamut. My head's overwhelmed with all the questions because I know where we're going today. But last time we touched on various things about therapy, maybe where to go to schooling, et cetera. Anything that you recall from last session that just stuck with you?
Just a question about the integration, is how do we integrate? And then Jesus being the model, it's not, a lot of psychology started in non-Christian contexts. And
Yes.
There's a lot of self-reliance, and a lot of analysis and, thinking that science by itself could heal. And I think the thing that both of us have appreciated is there's things we've learned in our formation as therapists that are very valuable, but they are really empty to bring about transformation without the power of God in the middle of that. And so it's how do we integrate what we've learned in our schooling to be a therapist, and that training is important, but also not rely on our own self-sufficiency or our own wisdom or our own knowledge, but really rely on God to work through everything that we've learned.
Yeah. I mean, it's a good segue to a very shameless plug. So shameless plug alert. We've got a therapist conference that we're doing coming up in 2022. So just want to highlight that for therapists out there who'd like to come together. There's not many openings. So I just want to let everybody know ahead of time so you get the best chance to register. And so that will be in Florida. Bob and I will do that as well with Sister Miriam. And that will be for psychotherapists. So anyway, check out Bob's website. We'll have links for all that in the show notes. Bob, how about let's dive into the questions? We've got like 6 or 7 that we're trying to get here. Again, these are the very common things we get asked, whether it be from therapists or things that we get asked from people interested in therapy or wanting therapy, et cetera. Maybe the first one, and I just to put it out there, Bob and I currently aren't seeing anybody. So that's maybe one to start with, is that we've kind of veered away from the private practice world, and now we accompany people, but do formation and training on the podcast and stuff. And so that's kind of our outreach right now. So just in case you were wondering, but we're really trying to pour into other people so that other therapists and people can really grow. So, Bob, one thing we said last time had to do with, what are schools that you could potentially go to get training? But something we get asked, I think, from therapists is, okay, I've got my degree. Is there any specializations or anything kind of unique that maybe I should go in and get more formation in, whether that be in, the psychology world or the inner healing world? I know for me, I'm literally about to do the basic training in something called Heart Sync. And that's something I've been hearing about. And so I'm going to be following up with that. And that's basically an inner healing method that it's almost like internal family systems meets inner healing prayer, meets trauma therapy, meets deliverance ministry. It's like this conglomeration of a lot. So that's one thing I'm doing. I can share the other things that I've been trained in over the years is I've been trained in EMDR. I've been trained in emotion-focused therapy. I've been trained in some play therapy that I used to do very early in my career called parent-child interaction therapy. I'm sure there's others, but I've been trained in theophostic prayer, or I guess that's called transformation prayer ministry. And I've done kind of my own self-education in manual healing. Those are the ones that come to mind for me. Like, what comes to mind for you?
Well, let me start with Heart Sync, because when you told me about that was a joy, because it's my old partner, Andy Miller, who he's now Father Andy Miller, because he's an Anglican priest along with a therapist. And we were in practice together for about 10 to 15 years, and then we taught for 20 some years inner healing together. So
it's crazy, small world.
Yeah, it's a small world, and he's going all over the world now. And
Yeah.
he did a lot of work with deep trauma, deep sexual abuse trauma,
Yeah.
ritual abuse trauma. He did a lot of that work. I did some of it. He did a lot of it, and
Yeah.
this really came out of that experience, along with everything that we were teaching and learning. So I just think that's a good, sound thing to be trained in for those people who want to do deep trauma work. It's not really necessary if you're not, but if that's your goal. Any kind of trauma training right now is good for people because
I agree.
we're seeing so much trauma surfacing, and being able to work with that trauma. And it can be anywhere from, I know good Catholic therapists who are Christian therapists who are doing art trauma therapy, music trauma therapy,
Very cool.
trauma therapy that's EMDR related, or somatic healing. All those, as long as the person's grounded, all those are good, sound methods to be used, including emotion-focused therapy or internal family systems. I've been exposed to a lot of those over the years, but my formation was in family relations, and so I was trained in a lot of family therapy, marital therapy kind of work. Plus, I developed a kind of an individual family systems model, not learning the techniques, but from that work. So there's been a lot of training over there. I mentioned the Catholic Psychotherapy Association, the Association of Christian Therapists, the American Association of Christian Counselors. Those all have been sources of learning over the years.
Yeah.
Plus reading a lot.
Yeah, that's a really good point. Like, I would say, just to piggyback off of what you're saying right there, I'd probably learn more from just picking up books along the way and going, wow, that really resonates, or conversations with people, which when you were just sharing there, it reminded me of a few other things. I've really appreciated, from more of a secular point of view, interpersonal process therapy. It's one of the things that they teach at Divine Mercy. Edward Tiber is one of the founders of that. It's not very well known, but when I read their book, which is really expensive, Bob, if we need to have a side gig, we should go into textbook writing. It's like so expensive, this book. But anyway, the concepts were just they integrated a lot. They were relationally based. And I thought, this is a good foundation as just a basic kind of, when people talk about unconditional positive regard, Rogerian type stuff, to me, this is the new Rogerian in a way. That's my word. That's nobody else's word. That's my label. But that's another thing to check out. I've also appreciated something called AEDP, I think it's called, Accelerated Experiential Developmental Psychotherapy, something like that. So if you Google AEDP, again, it's kind of parts work, neuro stuff, et cetera. Those are other things, I think, more on the secular front. But so we're going to have a lot of links, I think, in our show notes this time. But anyway.
My other training that was very influential early on after graduate school was in family reconstruction and
Virginia Satir's?
that kind of a development out of that, yes.
Oh, okay.
And family sculpting. And, you see that now in our teaching, but it was instrumental in my own healing, but also for years I ran groups of family reconstruction groups for about 25 years.
Yeah, I've seen some really powerful stuff happen in reconstruction groups. It's really, for those that kind of like more an experiential approach, it's like, oh man, it's the best.
Yeah, it's kind of like the inner healing on the outside, It's
wow, that's a good way to put it. Right.
It's an external, relational inner healing process in a sense.
Yeah, that's really good. Here's another one. Maybe we can touch base on this quickly. What is EMDR? We get a lot of questions about what is EMDR? Is it okay to use, et cetera? So I'll give a quick background, and then you listed off some things when the mics were off about some important resources, I think, there for people. So EMDR is an acronym that stands for Eye Movement Desensitization and Reprocessing. A woman by the name of Francine Shapiro started it. I think she started it back in the 80s or 90s. I'm not sure. But it's been around a long time. It's one of the most well-researched psychotherapies around right now. So for people, in their professional worlds and their colleges and boards of certification needing empirically supported treatments, EMDR is right up there with EFT and CBT.
CBT is cognitive behavioral therapy.
Yeah, thank you.
EFT is emotion focused. Yeah.
Yeah, thanks for that. The acronyms become plentiful.
Yeah.
EFT is often confused, emotion-focused therapy, with, there's another EFT that's more of like a tapping kind of emotional freedom technique is the other one. But I'm talking about emotion-focused therapy. Thank you. Those are very well researched. So EMDR is basically a trauma therapy that's a lot of neurosomatic processing as well as memory work. But you were mentioning kind of some charts that you've come across that did a really cool comparison of EMDR and inner healing.
Yeah, one of the people I think is doing great work is Carl Lehman, the psychiatrist from Chicago area who started Emmanuel Process.
Yeah.
And he's developed all these charts, and he's done research comparing. He's kind of summarized research comparing different methods and their similarity to inner healing prayer.
Right.
And their differences and the things. And what was really interesting is inner healing prayer kind of met all the criteria of all those methods and added dimension. So, in research, he's finding that the inner healing prayer was actually superior to each of the methods, but they had a lot in common with each of the methods. And he validated the effectiveness of those methods, even without inner healing prayer. And so what we found with a lot of people that we know is they're integrating inner healing prayer into those methods. I also mentioned people in Intuitus Counseling Center in Austin, Chris Sperling and Liz Hertz, who did a presentation for Catholic Psychotherapy Association comparing and contrasting EMDR with inner healing prayer. And there was a lot of overlap and similarity in terms of going down to the roots and dealing with the beliefs and those kind of things. And then the places of separation or how the healing happens. With EMDR, the healing happens just by kind of diffusing the trauma as you're focusing on the truth in the memory. With inner healing prayer, there's a focus on an encounter with Jesus who brings you the truth. And you could say those are similar, but I think there's a different dynamic that happens when you invite God's presence into that moment in a different way than when you don't consciously do that. Just my experience of that.
Yeah. I found actually with, when I first learned EMDR, I had already known what was previously called Theophostic Prayer and now called Transformation Prayer Ministry. And I thought that Ed Smith copied the EMDR protocol. They were so similar. I thought, somebody copied somebody else here. So when you're talking about the similarities, it's really shocking how similar they are. But I mean, you make a good point about the integration of prayer and, Christ, the healing power of Christ into a method. And that's a good example of what we're talking about when we say integration, the work of integration.
Yeah. And if I could say, just in terms of, I've just experienced a little bit of EMDR. So I'm no expert on it whatsoever. I'm not trained in it. But I know lots of people who I respect who have either received it or practiced it, including one of my partners.
Yeah.
And what I've found is that EMDR seems to go deeper into the trauma, which has a good and a bad.
Right.
My sense is that inner healing prayer, there's always a sense of the Holy Spirit only going as far as the person's able and ready to go.
Good point.
And sometimes in EMDR, my experience has been people get into a level of trauma that's kind of hard for them to come out of for a couple of days. Whereas in inner healing prayer, I don't ever find that when the inner healing prayer is complete. Sometimes when it's not complete, I find that same thing. But when it's completed, I don't see people lingering in their pain. It's like there's a freedom in it after the prayer. So just an observation of the two approaches.
I've noticed the exact same thing. One person put it this way: EMDR is kind of like a jackhammer, and inner healing prayer is kind of like a scalpel. Both will get underneath the surface in different ways. Yeah, the jackhammer can be a little bit more intense. Let's move on to, is it okay? I think we get asked a lot, kind of, how do you pray in a session? And is it okay to pray? And how do you do all that? And how does that work? And again, that's an integration question. And I think it's something, again, shameless plug for the therapist conference, we're going to dive into that more there. I found it's really interesting when you think about all of the, can I pray in a session? And one thing that I've considered over the years is to always be conscious of the person that I'm sitting with. And because Jesus was.
Right.
Jesus was very conscientious of whomever was in front of him, and that informed how he interacted. So he interacts very differently with varying groups of people. And so I think there's a cue that we can take there. And so obviously when you're in training to become a therapist, one of the ethical things we're taught is don't impose your views or your worldview on people. And I would agree with that. I don't think it's healthy for the therapeutic setting to be the place for evangelization. That to me shouldn't be the explicit place for that, because you're dealing with people who are in vulnerable situations and scenarios. There's other places to evangelize. But what's interesting is that in my experience, evangelization takes care of itself when you're living as a disciple of Christ and a therapist.
Yes.
I never had to worry about that because it just kind of took care of itself. When you are trying to love like Jesus and Jesus shows up, people are impacted.
Yes.
Usually in my practice, I think it was similar for yours, most of the people knew my worldview. They knew I was coming from a faith background. And so if I didn't pray, they were bothered, right? So let's say I was very busy or whatever, and I forgot to start with even an opening prayer. They were kind of like, well, can we start with a prayer? And I'm like, I'm sorry. I'm lost my rhythm there. And I found that really interesting. But on the other side, if I'd have prayed with some of the secular clients that I worked with, that would have been very off-putting. They would have been like, what are you doing? What was it like for you?
Yeah, very similar. Early on, I had a lot of people who were not from a faith background, and I was not kind of publicly known in that way because of over time that reputation develops. And so more and more as I went, more and more the people were coming of faith who wanted that kind of approach. And it was actually, once I started that, I never had an opening. It was just like the hunger was so great. And it made me really realize there's a great hunger that's not being met. And right now we have that same thing, is that we can't find enough people to refer to all the people who are interested. So that's one of the reasons why we're doing the therapist conference, is we really want to help support people as they grow in that to have more availability. But I think it's unethical to in any way impose spirituality or prayer in a way that's violating the person's will, because the whole of therapy is the safety of respecting and honoring the person's will.
Yes.
However, there were times with people who were quasi-believers who were getting ready to go have an abortion.
Right.
And the professional ethic says you never take a stance on that.
Right.
But my Catholic conscience said, this is a human life.
Right.
And I need to speak up. I need to at least speak up to get them to examine why they're doing what they're doing. And again, so there's some fine lines there. Or somebody wants to divorce or have an affair or something like that. There are places where even with somebody not of faith, there are ways of talking about those kinds of experiences to help them re-examine their mindset that's going into that. Later on, as it became more and more majority Catholic Christian, some non-Catholic Christian, I would say maybe 30% non-Catholic Christian, 70% Catholic Christian, hardly anybody that wasn't. Like you, they came wanting prayer. I mean, they wanted to incorporate that. And I know there's some therapists who have discomfort charging a fee and praying with people, which I respect. Yeah. And I wrestled with that a little bit, but I said, what is going to be the most effective help for this person?
Right.
And when I asked that question, it was like, how could I withhold that as a therapist? But for those people who aren't comfortable praying in therapy, then it's finding people who do inner healing prayer. And sometimes I would just rather than refer to a therapist or a psychiatrist, I'd refer to people who do inner healing prayer.
Yeah. Bob, you bring up a good point just about money. And I just think it's worth just mentioning for both sides that it's really an awkward dynamic when it comes to money and therapy and inner healing and all of that. And one of the ways that I just kind of cut through it with people was, this is my livelihood. This is how I support myself and my family. And so you go to a mechanic for your car, I'm kind of like a mechanic for your heart, for your soul. So not paying means I can't keep doing this, right? And so most people were like, oh, I get it, right? And they didn't have a problem with it. Some did, and that's okay, and we would work that out. But I think a lot of people can understand that it's a service that you spend a lot of time, money, getting trained to be able to do it. And so if you want to do it, ideally you can do it in such a way that you can provide for yourself and for your family. So
Yeah. And nobody goes to be a therapist to be rich. I mean, you
no.
And the other part with money is, for me, ethically, I always needed to meet the person where they were. So if somebody couldn't afford anything, it was like somebody who had no ability, I was going to see them with their ability. Or if somebody could only afford so much so often, we would work that way. So again, not putting it on the side of what's right for me as a therapist, but what's right for you as the one receiving.
Yeah, those are all, I think, really important kind of dynamics. There's something you mentioned as well that I think is just something you and I potentially we take for granted, but when I say it, we don't take it for granted, is the basic formation in our faith. We did a lot of formation in what it means to be a Catholic and living Catholicism, the teachings of the church, and not just from a point of view of knowing right and wrong, but really understanding how that applies to a life well lived and why living well matters. And that integration is really important. And I noticed when we first met, there was a lot of givens that we already kind of knew. Like we had done our homework, and I can't emphasize that enough for people, that when you're going into therapy, having a solid anthropology, which then informs moral behavior and informs like prayer. I mean, so much of that background you and I started our therapeutic career already having. So for therapists, I would say some therapists need to just really understand the faith well, but not from a legalistic point of view, but from an integrated point of view of, why should I not kill? Instead of just going, hey, fifth commandment, don't do it. Or I think that's the fifth. Anyways, one of them. But why should I not kill? That's a heart dynamic as well as a behavioral dynamic.
Yeah.
And so that's important.
And how is resentment and bitterness a violation of the fifth commandment? And where is that in my heart? And how do I help people not just not kill, but not hold resentment and bitterness? And how do I do that in my own life? Those are the places where that's lived out.
That's so good. And a therapist living themselves an integrated life.
Yeah.
I think we're going off a script here a little bit, but I think that's so important.
Yeah, I think it is. And I think it's getting to one of the questions we want to get to is, how do you choose a good therapist? That's really important.
Yes. Well, so let's do that one. What would you say?
Yeah, I would say ask the people around who they know and who they recommend. There are people, a good therapist has a good reputation in the community.
That's true.
And if you're interested in somebody with a particular faith background, I think that's a good idea. That doesn't mean that you go to somebody with a faith background that doesn't have any skill as a therapist. It means if there's somebody who's really integrated and is a good therapist and is solid in their faith orientation that matches where your heart's coming from, is going to respect where you are, and is going to help you grow out of the places where your faith has become self-protective, kind of as a religious fortress, and help you move into the living in communion with Jesus, in communion with the Holy Spirit. That's really important. Not somebody who just has a creed that's like your creed, but somebody that can help move your heart into a relationship.
Bob, that's a big distinction, I think, because you can, oh yeah, I'm Catholic.
Right.
To me, that unfortunately doesn't mean a lot. I want to know how do you live your faith, and how does that come out in everyday life? One of the things I tell people a lot, secular, non-secular, is that when you're trying to choose a therapist, a lot of people feel like, oh gosh, I've already started with this person. It's not really going well, but I don't want to restart. And my thought is, you should know after the first session or two whether or not you fit well with the person. And if you don't, the best thing you can do for everybody involved is stop seeing that person and go find somebody else, because the therapist will struggle, you will struggle. It's just, I see too many people linger when they should just call it quits. And therapy, as therapists, we are trained and should be okay with that, because it's not about us. It's about what's good for the client.
Yes, that's a lot of wisdom there, Jake. It's really important that people say, well, I just don't know. And so good, give it another time. But if you aren't clicking for the first couple of times, then it's not a good fit. You will know. Yeah. You will know.
Yeah. Do you feel safe? Do you feel like they can care for you?
Do you feel understood?
Yeah. Yeah. Here's one that it's a little bit more difficult to ask, but have they ever done therapy themselves? In other words, do they know what it's like on your side of the room? Personally, I won't see somebody who hasn't ever been to therapy themselves.
Yeah.
It's kind of like, I'm a big proponent of, this special water, but I won't touch it. I won't even drink it. I'll never drink that stuff. But I tell everybody else to do it. I'm like, what? That doesn't make any sense. Like, what?
Yeah. The other thing to be aware of is somebody who hides behind technique.
What do you mean?
That is, you don't feel any kind of relationship with the person. It just feels like they've got their notes and they're following a script and they're bringing you through a process. And it's just, those processes can be good, but they're good if they're human.
Yeah.
If they're incorporated into a relationship. And so if you feel like there's just a strange disconnection with the person, and their boundaries are so good that they don't even relate to you, it's probably not a good fit.
Yeah, I totally agree. Another one in this regard is you're not going to find usually one therapist that will help you in every season of life. I think a lot of people are looking for the silver bullet therapist who can handle everything and they stay with them forever. And that's not really normal, And so usually you'll find somebody who's there for a season.
Yeah.
And that season will be a time, and then you might move on and go find another therapist in the future, and that's totally okay.
Yeah, one of the questions that I get a lot is it okay to go to a marriage therapist and to have the person work with both members of the couple? And, it depends on the therapist and whether he's able to be non-biased on both sides.
Right.
But let's say the wife starts and he's the individual therapist for the wife, and then the therapist invites the husband in, and he's already got the husband pegged based on the wife's observations. He's not going to be a good therapist for the husband unless the husband comes in and he feels understood and received, and he develops the relationship with the husband in the way that he developed it with the wife, and then he can work with them as a couple. So those kind of things can get tricky in therapy.
Yeah, I agree. Yeah, that's something you'd call a dual relationship. Those are hard to navigate, especially in small communities or in small faith circles. Like I found that it was very hard, where I would often go to church with my clients because the Catholic world got pretty small pretty quick. And so that was a tough kind of thing to navigate when you're in that setting, which, Bob, maybe that blends us over to this other thing we were going to talk about with regard to boundaries.
Yeah.
So just a precursor. Okay. What are boundaries? Boundaries are just basically an acknowledgement of where a relationship starts and where it ends. And boundaries are very healthy and normal across the board. A really good book on boundaries is called Boundaries by Dr. Cloud and Townsend. Yeah, that's kind of a classic staple book. But boundaries are very important in therapy and in working with therapists. They become a bit more difficult in smaller communities, but there's still something that's important to address and be aware of. One of the things that I know you and I have acknowledged and wrestled with over the years is, and so I'll distinguish something, kind of the professional expectations of a therapist versus, and here's what I'll call the other category, what love requires.
Yes.
And sometimes those don't match. And so love might ask you to do X, Y, or Z, and yet it's pressing into, gosh, how do I manage the boundary here? And so over the years for me, I've always tried to ask the question, what does love require? Because that's ultimately why I'm doing what I'm doing. Now, 99 out of 100 times, they're okay. They kind of match. But there are times where love might require me to do something where it's a bit of above and beyond. Here's a simple example. I had a client. Now, some people might go, Jake, this isn't a boundary violation. That's just being a good therapist. And I'm okay. Well, that's part of the discussion that's valuable. Is I remember having a client who, very, very traumatized woman, had severe. I won't go into her story. It's really difficult. But there were times where she was really, really struggling with suicidal ideation, which means she was really struggling, wanting to kill herself. And I would take her to McDonald's. And we would go to McDonald's, and that was one of the ways that really helped her feel like somebody cared. In other words, I was willing to go get a Big Mac with her, and that was it. That's all we did. Got a Big Mac, and then we left. And it was like her saying, wow, you care about me beyond the therapy setting. Now, it didn't go further. We didn't talk anymore outside the session. She didn't email me 100-page things in between sessions and all of that. It was basically a way for me to care. Now, technically you could go, well, you crossed a boundary. And I would say, well, I think love required that of me in that setting.
Yeah. There's a lot coming to my mind as you're sharing this.
Yeah. Okay.
One is, both of us having done some child therapy, and particularly with adolescents, with child therapy, you'd get on the ground and play a little bit, but with adolescents, you'd probably go out for a walk somewhere.
Yeah.
Right? Get outside of the office because it felt too clinical for them.
Yeah.
And you could do that with an adult client, but all of a sudden, the shift from an adolescent to an adult and doing that, it communicates something different.
That's good.
And it's not that it's bad or it's wrong,
right?
But it's different. And I'll give you an example in my own experience, kind of like your McDonald example, but it's a little more intense.
Sure.
I had a woman early on in my practice who had lost a baby, and she was talking about how she had not grieved the loss of the baby, and it happened several years earlier.
Right.
So I asked her, where the baby was buried, and she told me, and I said, have you gone to the gravesite, just sat there? She said, I can't do that. And I said, could you do that if I came with you? And she said, I think so. So I came with her to the gravesite, and again, do what love requires, but this issue of boundaries. And again, I'm a young therapist. I'm not really realizing the implications of this. What I found out as I went with her and she was able to grieve, she then attached to me in a way that she didn't with her husband, who had never grieved with her. And I come back to the session the next time, and she's wanting to leave her husband to marry me.
Wow.
It's like that my boundaries are really clear. No, this isn't going to happen.
Right.
So I was okay with that. And that happens in therapy. Sometimes people, it's called transference, just as long as you as the therapist aren't seducing that or, drawing that, again, which is part of the boundaries. But I really learned a lesson there. Not that I would never do something like that again, but I needed to look at what the ramifications might be by doing something at that level.
And you, Bob, you're describing something I think that's really just a very good distinction, is that in some cases, let's use that exact example, because I have a very similar story myself, and it was the loss of a spouse and helping the person grieve at the gravesite. You could have the exact same action, and I would do it with one person, I would not do it with another person.
Yep.
In other words, you can get a sense of the healthiness of an individual's boundaries while you're working with them, which can allow you to maybe or offer therapy in different ways. And usually boundary struggles often root back to an attachment struggle or an attachment wound, where you never learn secure attachments and you've got to overbond to make sure you're okay, or you push everybody away or whatever. And so I think there's just an important dynamic and distinction there. But very much to your point, gosh, this one, once again, the health of the therapist is huge in the room. It's so important in the room. So our attachment struggles as therapists come into the therapeutic setting and influence things. In other words, you can't leave yourself at the door.
Yes.
You actually don't want to. Otherwise, it's not personal at that point. But
Yeah,
if
no,
there's things that we need to do, we need to address them.
Yeah, I think that really opens up something that would be really good for us to discuss here.
Hey, Bob, I'm just going to cut you off for a second. I can hear a lawn guy in the background. I think you said that's your neighbor's lawn guy?
Yeah, I asked my lawn guy to not come, or to come before recording, and then this is a neighbor.
So listeners, we apologize for that. If it's been kind of going on in the background. I was like, what is that? That's not a giant bee. They don't have like giant wasps in Tallahassee that sound like leaf blowers. But anyway, so listeners, please, hopefully you can deal with that, or hopefully our producer can help get that out of there. But anyway, so Bob, sorry to interrupt you. You were about to say something that you felt like was a really important segue.
Yeah, one of the things as a young therapist that I was naive with is the power of good therapy in terms of attachment. You're bringing up this question of attachment.
Yes.
And both our self-care and healthy boundaries in the relationship.
Right.
Okay? One of the things, just like with the church, just like with teachers, the crossing of boundaries emotionally and sexually in therapy has happened in occasions. That's such a violation. That's such a deep violation, maybe as much as a violation of a priest with children or adults, because it's such a protected, needs to be safe environment.
Yes.
And so what do you do as a therapist? I remember early on when that was happening, and I was having people expressing, their desire, their affection, their love, they're wanting to be my friend, they're wanting to be my spouse, they're wanting to be whatever that was.
Right.
And it was like, what is going on? What am I doing?
Right.
Mostly what I was doing was caring.
Right.
But I didn't know how to deal with it at that point. And so, and the other thing was I was a young man.
Yes.
It's a little easier when you're older.
Right.
When you're a young man or a young woman, that can be sticky. And so I've heard women say, I'm not going to work with men while I'm a young woman, just because it makes me too vulnerable in that situation. As a man, I never felt that vulnerability for me, but I felt it for them. Yes. And so it's, how do you negotiate that? What would you say, Jake, how you've dealt with that over time?
Bob, I think it's just a really honest topic because it's very real. Because when you have two people in a room who are really trying to reach a common goal, bonding is pretty normal. And then all your individual stuff comes into the room. So I'm sure there are therapists out there that have been right on the line, have felt the line, have crossed the line. And there are clients who have experienced that as well. It's just such an intense and difficult scenario. Now, I'm not talking about coercive forcing. Like, that to me is not difficult. A therapist coercively forcing a client to do something is really bad. I'm talking about the experience where you find yourself all of a sudden thinking about a client more than you should at home. And you're thinking about your therapist more than you should at home. You're finding, like you said, gosh, I really like if I could, marry my therapist or whatever. And that kind of stuff, it happens because of the deep, intimate nature. So I just want to acknowledge that there's a level of understanding that can be had here. Now, this is how I navigated it. I had to be keenly aware of what I could personally handle. I had checks and balances in my life. For example, clinical supervision. I was regularly talking about that, and peer supervision, talking to my friends about the clients that I was, friends as in peers. Counselors, not just like my buddy going out to the bar or whatever. And all of that is held in confidentiality. I would also anonymously check in with Heather. So again, all of this is anonymous. Nobody knows who I'm talking about, but I'm checking in with Heather, and I'm watching my heart as I'm engaging in these conversations. And as soon as I feel like I want to start hiding something, or as soon as in my heart I feel this, well, I want to do this, something's up, and I need to catch that very early on. And so the areas of virtue or self-mastery would be a TOB way to say it, that I've developed in other areas of life will come out and be tested in therapy. And so if I know that I struggle with attraction to anybody, I need to be very cautious of that in the therapeutic setting because of the depth and nature of the work. And so it's like, I need to know my boundaries before I even walk into the room. I need to know my heart before I even walk into the therapy room. And even then, there's going to be times where you're going to have to watch it because, your heart can bond and you don't intend it to. I think when you mentioned the priest example, I've known numerous priests who've said, yeah, I've fallen in love.
Yeah.
But I never did anything about it. And it hurt and I grieved it, but I didn't act out on it. And I would say it happens for therapists too, where you become way too attracted to a particular client. But there's the test of the kind of individual you are. And that's the point of the whole thing. Those are just some ideas that come off the top of my head.
Yeah, those are good. And we could probably spend a lot of time on this, but let me just say that early on, I found myself responding rigidly, like out of fear. And part of this was my family history of my dad's unfaithfulness. Out of fear,
Yes.
I would cut off interactions rather than process them. Like maybe I need to refer this person, or you can't feel that way, kind of.
Right.
Thing.
Like stop it.
Stop it. Yeah. Yeah. There's a funny.
Yeah. A Bob Newhart video.
Bob Newhart. If you get a chance, everybody watch that. Stop it on YouTube. Just like stop it. Yeah.
That's the therapeutic technique.
Right.
It's the worst therapy you could ever imagine, but it's kind of funny. Anyway.
Yeah. And I'm exaggerating a little bit, but in my heart, there was this place of cutoff rather than processing. And as I matured, I was then able to process through those feelings and talk about them. The fear that I felt when that happened, or the attraction you have for somebody, or the threat that you feel by somebody being attracted to you. Why is that threatening? And it was irrational stuff a lot of times, based on my own woundedness. But until you deal with that woundedness, you're acting.
I would say the best therapists, here's a really good way to indicate if you're working with a good therapist. They have the capacity to work with a lot of different people and a lot of different things, and they stay grounded.
Yes.
That is very hard to do, like across the board, right? And so, it could be that, like, take my story, for example, a lot of woundedness with my mom, and then that manifested with women. So I had to be very careful with the women that I worked with. I mean, thanks be to God, I'd done a lot of work before I went into grad school and became a therapist, because I developed in that time a lot of self-mastery. I'm not sure what would have happened if I had gone into therapy as unwell as I was and not had done that work. I don't think it would have gone well. I think it could have gone really bad, because my heart was coming in with so many dynamics and needs, et cetera. And it's like you have a starving person with a starving person, and then they just start to consume each other.
Yeah.
And that isn't good,
No. Yeah. And none of this is to frighten people from therapy or being a therapist. It's just like, it's just acknowledging a dimension here of what happens when you develop a real relationship and why boundaries are so important.
Right.
They're to protect both persons. And, there's another side of this too, which was a boundary that took me a while to really live into well, which is the boundary of what happens in between sessions, in terms of phone calls, in terms of people's needs, all that kind of stuff. As a young therapist, I was just trying to be responsive to everybody. And, I would have people call me interrupting dinner or night. And I finally had to set a boundary for myself and for my family that I wasn't going to field phone calls in between sessions. Now, not everybody's going to have that same boundary. But because of my weakness in that area and the way that it was affecting dinner time and, time of sitting next to my wife on the couch, I needed to have that as a pretty clear, firm boundary.
Yeah.
Then I could relax it some once I had that internal strength, and then make discernment. But there was still places of vulnerability there that I had to be aware of.
Yeah. Bob, what you're describing, I would say probably one of my biggest weaknesses as a therapist over the years was self-reliance, where I counted on me to make things better.
Uh-huh.
And that was the worst, because just like you're saying, I would take on more care than I could actually offer, because I felt like I have to do it. I have to make this right. I have to figure, and that's my own stuff. And it impacted people negatively, because I'm taking on more than I can handle, because I have my own wounds around self-reliance. And then that impacts other people. It's just in the therapeutic setting, all that stuff is amplified because of the nature of the relationship. I had self-reliant stuff impacting people in other areas of my life. It just wasn't as prominent, right? So like you're saying, you're in deep kind of heart surgery with people that's going on for a year or 2 years or more. And it's hard to just go, okay, boom, slam the door, see you in a week. But that's extremely important. And so again, I guess what I'm trying to say is the personal work that the therapist does is such a good way to bless your clients.
Yeah.
It helps you in therapy.
It makes all the difference.
Yeah.
Let me use 2 examples of this that early on were places that I got hooked. And I've had to do a lot of work through these. Yeah. One was when somebody got into deep abandonment pain. Now, it's not hard to see in my story with, first of all, my grandparents dying in a fire in our house and all the impact of that when I was 6. And then when I'm 14 and my dad leaves and everybody's experiencing abandonment. My way of responding as a child was to take care of everybody rather than deal with my own pain.
Yes.
Okay. So naturally, that set me up as a therapist to feel responsible in the way that you described. And so when people would get into deep abandonment pain, there would be a place inside of me that felt this urgency that I had to be there to rescue them, because I didn't trust God to be there for them. And I didn't feel like it was safe for them to go through that without me being there.
That's so true.
As I grew and mature, and this is, again, long-term growth and maturity, realizing that I can hand them over to God and I can discern if I need to intervene or not. But for the most time, not to respond to that anxious feeling.
That's very good.
And it was worse when there was a suicidal aspect to it. And I know so many therapists who, out of fear of that, would call the hospital and get somebody hospitalized or have somebody, take extreme measures. And sometimes those are necessary. But when they're done out of that fearful, controlling place of trying to be God, it's always counterproductive. And so one of the things that I learned over time was be very, very reluctant to act out of fear as a therapist. Wow. Like if I'm afraid, stop, don't act out of it, process it, deal with it, and then pray.
Wow.
And then see.
Wow. Bob, that is gold. I'm just like, so many experiences in my therapeutic world where fear was driving my care.
Yeah.
Oh man. And that God blessed it in areas, and a lot of areas it just felt futile. Mm-hmm. One of the things that blew me away is that my clients, some of them, they could tell. Uh-huh. It was a weird situation when I'd walk into because these people had been so traumatized and grown so good at reading people, because that's how they learned how to survive, that I would literally sometimes walk into a session, sit down, and they would look at me. And it was kind of like, these are people I worked with for a long time, and they'd look at me and they would pause and they wouldn't start. And they would just basically, and I'd go, is everything okay? And they would kind of very quietly, shyly, respectfully go, are you okay? And then I'm like, oh, they could read me like a book, right? And navigating those, I don't want to get so far into these, kind of stories and tales of therapy and all, but what that was my struggles, my fears, my dynamics coming into the therapy room, which happens. I don't want us to come across as saying to therapists, you have to be perfect before you can do therapy. No, not at all. But if you're not aware of your imperfections and how they're influencing the therapeutic dynamic, then that's something something to watch out for and be concerned about.
Yeah.
Bob, how do you feel about moving on to kind of one final question?
Yeah, sounds good.
Anyway, maybe we'll circle back around this sometime in the future. But anyway, what are one or two things that you would say to therapists, and what's one or two things you would say to clients? Now, these questions are the most difficult for me. So anyway, I don't like these, but I'm putting us through it.
So you'll let me go first, right?
That's my gift to you.
Yeah,
Bob.
thank you. Yeah, I think a lot of what we've said is what I'd say to therapists. I'd say the first thing is get really grounded in your own healing journey and your own relationship with Christ. And that's not a fixed thing. That's an ongoing thing. When I say get really grounded, that's an ongoing process. Nobody's really grounded at any point in their life. It's an ongoing grounding.
Yes.
Have that be your focal point, which is
recognize
that you're the instrument in this exchange, and yet Christ is really the instrument. And how can I live as though Christ is living in and through me in this encounter, and become aware when that's being threatened by me pulling away from that and what's going on in my heart. So it's a lot of what we're talking about right now. I would say to therapists, that's probably more important than technique, more important than training, anything else. That's probably the key thing. So I'll let you answer that one before we go on to the client.
That's a bummer, because I was going to say the exact same thing. Every time I go into a grad class and I get asked to teach at my alma mater and come in and do random classes, that's the one thing I say. The most important thing you can do as a therapist is to continue your own journey. Don't ever think that you've arrived, because your health or lack thereof in the therapy room is highly influential, because you matter. You're really important in the session. Your fears, your wounds, your strengths, your glory, all of that is very important. So keep doing your own work, to me, would be the most important thing I would say as a therapist. Okay, I'll go first for the second one.
All right.
What's one thing I would say to clients is two things come to mind. One is, again, we already said it today, but I think it's because I have struggled with it and I feel it a lot, is Jesus is the silver bullet, the therapist isn't. And it's very tempting to feel like you're trying to find the one who's going to make it all better. Like here's an example of that. I'm a big John Eldredge fan, and he's been a major part of my formation. Well, he used to be a therapist, and I remember believing in my heart, in my deep struggles, if I could just work with John Eldredge, all my problems would get better. And the reality is I never did. And I've made massive growth in my life. And all I ever did was read his books. And so the feeling of I've got to have that one person, we're actually longing for Jesus. And it's very easy to want that out of a therapist. And so you'll have different therapists for different seasons, and that's very normal. I mean, I've probably had, I can think of like 6, maybe 10 over the course of my life, people who I have worked with over the years as the client, and they all were very important in their particular season. I think the other one would be my encouragement to people of don't stay in therapy for the clients. Don't stay in the sessions just because you're like, it's not really working, but whatever. And then if you find that it's not working, don't give up on therapy. Because some people go, well, I tried it once. And I'm like, that's not how it works. Like, it's not, I tried it with this person and they didn't help me. Therefore, no therapy will help me. That's a bit overreactive, I would say. So what about you?
You chose my first one, which is Jesus is the physician. He's the therapist, and keep your focus there even while you're building a relationship of trust with the therapist.
Amen.
So just reaffirm that. And it's not just in the therapy room that he's the therapist. He's the therapist.
Well said.
In every part of your life, and that the healing is going to take place. I would find person after person that came in, and they were dealing with whatever distress they were dealing with. And at the end of my career, I would be able to say, God, you're so beautiful in the providence of the way that you've arranged their life for this moment to bring this healing, because everything that they'd experienced during the week was their preparation for the session. So to recognize that it's not just a session, it's all of life, that Jesus is healing you through the sacraments, through the church, through the scriptures, through friendships, through marriage, through family. All of that's part of his healing. And so to be able to look at him and the whole thing that he's doing rather than focus in on the therapy.
Yeah.
Second thing I would say, and again, we've already said this, but I just want to underscore a piece of this, is when you feel safe, your heart's going to trust and you're going to open. But as you open, you're going to get to a place, if it's longer term therapy, you're going to get to a place where it feels out of control at some level. You know, your heart is going to get to a place of vulnerability and require a decision to continue or to back away.
Wow.
And if you really have a relationship with God and you can feel safe enough, you can go through that place and be okay. But a lot of times it's like going through the valley of the shadow of death.
Yes.
And, you know, Jesus is the good shepherd, but you don't see him and you don't feel him and you don't know him in that place when you're touching some of those places. And so I'd say just continue to persevere there.
Yes.
And that's a great moment of faith. You know, it's akin to the dark night of the soul, the dark night of the senses. It's a great place where you're just choosing to trust, even when you're feeling vulnerable and a little bit out of control. That's not failure of therapy. That's success in therapy. You're getting to a place beyond your defenses. And again, this is often takes a while to get to in therapy, but that's really good therapy. And when you get there, rely on God even more, not less, even if you can't see him and know him and feel him.
And Bob, that is really good, what you just said. Therapy's hard. It's hard work. And yeah, you're so right. Yeah, I just really want to highlight that for listeners. For anybody in therapy, when it gets tough, there's usually some pretty powerful stuff around the corner. It's just how long will around the corner take? Nobody knows that, but usually if it hurts, and there's a good kind of hurt and a wrong kind of hurt. And, you know, the vulnerable kind of hurt because you're trusting and getting into things. That's so important in therapy. And you're right. So many people pause right there and then they don't experience transformation. Well, listeners, I hope that this blessed you. And I hope that you could, if you're a therapist, we hope that this helped you kind of maybe put some more ideas in your mind that can bless you. And if you're looking for therapy, we hope that this can just help you find somebody who you can work well with. Coming up, we have a series coming up on leaders and restoration and healing with regard to leaders. I'm really looking forward to that because we've got some more special guests that are coming. So that should be really fun. So we invite you to check that out. So just one quick shout out to our patrons. We're very grateful for you patrons. You help keep this going. You help the podcast occurring. So if you want to continue or you want to start supporting our podcast, you can go to our website, restoretheglorypodcast.com. And on there, you can click a link that talks about Patreon and being a supporter. Bob, good to be with you. And everybody, until next time, God bless you.